Well, that was easy. Get everything you need in one place. At Quartz, you can find easy-to-use appliances and electronics, plus effortless furniture for every home at unbeatable prices. Get it now and pay later. Only at Quartz, bringing value home. Special conditions apply. Offer ends 28th January 2023.
Is a fact, strictly facts, and it's that.
When we were living abroad, my son ran outside he had a massive meltdown, and ran outside and ran straight into a post and split his head. And that was the beginning of understanding that in a meltdown he could really hurt himself, and really having to try to figure out what, and even abroad, when we lived in India in the beginning, therapists were expensive, and then I didn't think that the company covered it, but I think we found a center that had everything for one fee or something like that. When we got to another country, there were no therapists available. And then when we got to the UK, therapy was extremely expensive. And it's funny that I could get on the company's insurance, I could get a massage. If I say that I have a bad back, I could get a massage, but my child we couldn't get compensated for my child's therapy, which is, I think, might still be the case, and which is wrong, because therapy is essential. Here, it has been difficult to access therapy because it's almost all paid. And therapy isn't cheap. It's $3.50 for a half an hour session, I think. Well, I think it might be more than that now. But you're talking about psychologists, a speech therapist, an occupational therapist. So therapy isn't cheap. So when we got back here, I think I kept up only with speech. And I try to do as much, read as much, and surround him with as much stuff. So I made sure that he did a lot of Lego building, a lot of clay work. I would take him there are pottery studios. I would take him to a pottery studio. I didn't force the pincer grasp. I just encouraged, So I let him use. I remember, using beans to pick up beans and that kind of thing. And we did things like that. We would play with the wheelbarrow. We'd roll him into. So all those things, we'd engage him. And nightly routines, had a massage almost at least twice a week. We had a massage built into a nightly routine. But 2 years ago, he developed seizures. And that in itself is a rough thing to see as a parent, and that's when I realized that this may be even more costly, because he has had to have an MRI, and thankfully at the time there was a visiting neurologist, so he got seen by that neurologist. But I was told, it might be part of his puberty, it might be one-off, it might be the autism. So you realize that, it is not a cheap thing. And then COVID-19 comes around and wipes out, whatever you're putting aside for it's a challenge. It's a challenge, and definitely I think I see the divide between him and his brother, because his brother has had episodes where he's been ill, and I see the divide where okay, his brothers had those challenges, and I'm like, okay, right, that's a one-off or what, but I see whatever as a continuation, and yeah, that is a challenge.
It's a different kind of mind. It is probably a little different than yours and mine. It's a different kind of mind. It's a no puzzle if you just try. You'll be all mine. The rainbow scene and a brand new vibe. You'll be all mine. 4, 3, 2.
A seizure is a sudden, abnormal surge of electrical activity in the brain that results in changes in behavior, movement, or sensation for a patient and may result in partial, full, or no loss of consciousness. There are many different types of seizures, but the most common one is known as the generalized tonic-clonic seizure. This is where there's sudden loss of consciousness followed by generalized stiffening, followed by convulsions of the entire body. This can last anywhere from 30 seconds to 3 minutes, but they can last longer, and if they're 5 minutes or longer, the paramedics should be called. So the first thing you want to ensure if someone has a seizure is that they're safe. So if they're on a chair or in the bathtub, be sure to get them onto the floor and turn them on their side. Loosen anything tight around their neck. Place something soft under the head. But do not, I repeat, do not place anything in their mouth. No spoons, no forks, or anything in their mouth. And you ensure that you stay with them until they are alert again. There's several treatments for epilepsy or those with a heightened tendency to have seizures. The first would include anti-epileptic drugs. And these are medications that actually slow the hyperexcitable nerve cells which cause seizures, or they activate the inhibitory nerve cells which stop seizures once they start. The second would include surgery. If there's an abnormal part of the brain that's the focus of seizures or that causes seizures, this can be removed once it won't be devastating to the patient's day-to-day functioning. Third would be what we call neurostimulators, and the common one is the vagus nerve stimulator, which actually activates one of the nerves which helps to slow seizures once they start. And a fourth, in some patients who have severe seizures, a ketogenic diet, which is high in fat, lower in protein, and much lower in carbohydrates, may help to control seizures by at least 50%. Whether someone outgrows a seizure depends on the type of seizure. There are provoked seizures in which there's a reversible factor such as a fever, an infection, or medications which once reversed or removed from the system would no longer make that person prone to having seizures. And then there are unprovoked seizures in which there's something wrong with the brain tissue itself, which is the cause of the seizures. But even in the unprovoked seizures, there's some that people grow out of. Some such as absence seizures. The vast majority of kids with absence seizures, which include staring for a few seconds, they may grow out of that. Or seizures known as BECs, benign epilepsy with centrotemporal spikes. Almost 100% of kids grow out of that. So it all depends on the type of seizure.
Well, that was easy. Get everything you need in one place. At Quartz, you can find easy-to-use appliances and electronics, plus effortless furniture for every home at unbeatable prices. Get it now and pay later. Only at Quartz, bringing value home. Special conditions apply. Offer ends 28th January 2023.
What's up, Trinidad and Tobago? This is your girl, Giselle Mary Juanita Alvarez, the one and only, all right? Coming to you from Cause and Effect headquarters. So here we're going on now. Every week, Cause and Effect does get at least 3 to 5 calls from parents, people from all over Trinidad and Tobago looking for a sense of direction about what to do with their children with autism. You understand? So if you want to keep the work going to help people be more informed, visit we social media pages, Cause and Effect, Facebook, YouTube, Instagram, and we website www.causeandeffect.co, right? And press that donate button. Help we to keep the work going, all right? As Ms. Winterbottom does say, give a little, change a lot. I'll go see you all next week.
It's a different kind of mind. It is